Have you ever believed something that could actually be harming your dog's health? Today, we're going to talk about an extremely important topic that could change the life of your best four-legged friend. With so much contradictory information circulating on the internet and being passed from person to person, many pet owners end up believing advice that, far from helping, can reduce the quality of life and even the life expectancy of their dogs. In this video, I'm going to reveal 8 common but dangerous myths that millions of pet owners around the world still believe. These myths are not just harmless misconceptions. They can have serious and lasting consequences for the health of our canine companions. Before we begin, please leave your name and the city you're watching our content from in the comments. Myth 1. Dogs can eat the same foods as humans. This is one of the most dangerous myths that exist in dog raising. Many pet owners think that if a food is safe for us, it will automatically be safe for their dogs. The reality is completely different and can be fatal. Chocolate contains theobromine, a substance that dogs metabolize much more slowly than humans. While our body quickly processes this substance, in the canine body it accumulates, causing everything from vomiting and diarrhea to heart problems, tremors, seizures, and death. Dark chocolate and baking chocolate are the most dangerous, but even white chocolate can cause problems. Onions and garlic, even in small amounts or in powder form, destroy dogs' red blood cells, causing anemia. This condition can manifest days after consumption, making it difficult to identify the cause. Grapes and raisins can cause acute kidney failure in dogs, and we still don't know exactly which substance causes this toxicity. Some recent studies suggest it might be tartaric acid, but the important thing is to know that there is no safe dose. The canine digestive system is fundamentally different from ours. They have difficulty processing lactose, strong spices, alcohol, coffee, and many other foods we consume regularly. Food poisoning in dogs can cause everything from gastrointestinal discomfort to vital organ failure, depending on the substance ingested and the amount. Prevention is always the best strategy. Keep these foods away from your dog's reach and educate the whole family about the dangers. Myth number 2. If the dog is eating and playing, he is healthy. This belief can be extremely dangerous because many serious diseases remain silent in the early stages. Dogs are masters at hiding signs of pain and illness, a survival instinct inherited from their wild ancestors. Heart disease, for example, can be developing silently for months or years before showing obvious symptoms. A dog can continue eating normally and still play, but already have significant compromise of cardiac function. Similarly, kidney problems often progress to advanced stages before symptoms become visible to pet owners. Canine diabetes is another classic example. Initially, the dog may seem even more active because it's constantly hungry and thirsty, but it's actually developing a serious condition that requires immediate treatment. Malignant tumors can grow internally without causing obvious changes in behavior until they reach concerning sizes or spread to other organs. The importance of regular checkups cannot be underestimated. Annual veterinary exams or biannual for elderly dogs, including basic blood tests, can detect subtle changes that indicate disease development. These exams create a health history that allows the veterinarian to identify gradual changes that might go unnoticed in daily life. Early detection not only significantly improves prognosis, but also reduces long-term treatment costs. Myth 3. Dogs don't need toothbrushing. Neglecting oral hygiene is one of the main causes of health problems in dogs, and the consequences go far beyond bad breath. More than 80% of dogs show signs of periodontal disease by 3 years of age, and this condition can have serious implications for the entire body. Periodontal disease begins with bacterial plaque buildup, which turns into tartar. The bacteria present in the mouth don't stay isolated there. They can enter the bloodstream through inflamed gums and travel to vital organs. Research shows a direct correlation between severe periodontal disease and heart, kidney, and liver problems in dogs. The heart is particularly vulnerable because oral bacteria can lodge in heart valves, causing endocarditis and other cardiovascular problems. The kidneys also suffer as they need to filter toxins produced by bacteria, overloading these vital organs over time. What many pet owners think is just dog breath may actually be a warning sign for serious problems. Red gums, bleeding, difficulty eating, and pawing at the mouth are signs that the situation has already progressed significantly. Daily toothbrushing is the most effective form of prevention. Always use toothpaste specific for dogs, as human toothpaste contains substances toxic to them. There are also alternatives like veterinary-approved dental chews, water additives, and special diets formulated for dental health. The important thing is not to ignore this fundamental aspect of canine health. Myth number 4: frequent bathing is bad for dogs. This confusion arises from the difference between excessive bathing with inadequate products and adequate bathing with appropriate frequency. The truth is that the ideal bathing frequency varies drastically depending on various factors specific to each dog. Dogs with skin allergies or atopic dermatitis, for example, often benefit from weekly or even more frequent baths using specific medicated shampoos. These baths help remove allergens from the skin, reduce inflammation, and control secondary infections by bacteria or fungi. Veterinary dermatologists often prescribe bathing protocols that may include daily baths in the first weeks of treatment. The problem is not in frequency, but in using inadequate products. Human shampoos or products with aggressive chemicals can indeed dry out the skin and remove natural protective oils. However, shampoos formulated specifically for dogs, especially those with natural and moisturizing ingredients, can be used frequently without causing damage. Active dogs that spend time outdoors, dogs with skin folds, or those prone to skin infections may need more frequent baths to maintain skin health. On the other hand, dogs with double coats or certain breeds with protective natural oils may need less frequent baths. Proper cleaning, including regular bathing with appropriate products, actually helps prevent dermatitis, fungal infections, bacterial proliferation, and other skin conditions. The secret is using the right products and adjusting frequency to each dog's individual needs. Myth 5: small dogs need less exercise. This extremely harmful myth is based on the false assumption that body size determines exercise needs. The reality is that many small breeds were developed for jobs that required high energy and endurance, making them more active than many large breeds. Jack Russell Terriers, for example, were bred to hunt foxes and can run for hours. Border Collies, in smaller versions, maintain all the energy of their larger relatives. Many toy breeds, like the Papillon, are surprisingly athletic and need adequate physical stimulation to maintain mental and physical health. Sedentary lifestyle in small dogs can cause the same problems that affect large dogs: obesity, diabetes, joint problems, anxiety, destructive behaviors, and depression. In fact, obese small dogs can develop proportionally more serious joint problems due to concentrated pressure on smaller bones. Exercise doesn't have to be just long walks. Small dogs can exercise adequately through interactive play, fetch games at home, adapted agility, or even shorter but more frequent walks. The important thing is that they receive adequate physical and mental stimulation for their age, breed, and physical condition. The benefits of movement go beyond physical health. Regular exercise improves cardiovascular function, strengthens muscles and bones, maintains ideal weight, stimulates mental function, and provides environmental enrichment essential for psychological well-being. Dogs of any size that don't receive adequate exercise often develop behavioral problems that can be completely prevented with appropriate physical activity. Myth number 6. Vaccines and dewormers are not that necessary. This dangerous misinformation can have fatal consequences not only for individual dogs, but for entire communities of animals. Canine vaccines protect against diseases that can be deadly, highly contagious, and in some cases, transmissible to humans. Parvovirus, for example, can kill a puppy in a matter of days, causing vomiting and diarrhea so severe they lead to fatal dehydration. Distemper affects the nervous system and can cause seizures, paralysis, and death. Rabies is 100% fatal once symptoms appear and can be transmitted to humans through bites. When vaccination rates decline in an area, we see outbreaks of these diseases. Studies have documented parvovirus outbreaks in communities where many owners stopped vaccinating their dogs, resulting in deaths that could have been completely prevented. Herd immunity protects not only vaccinated dogs, but also those who cannot be vaccinated due to medical conditions. Dewormers are equally important because internal parasites can cause severe anemia, malnutrition, serious gastrointestinal problems, and, in extreme cases, death. Some parasites, like Toxocara, can be transmitted to humans, especially children, causing serious health problems. The vaccination and deworming protocol should be individualized by a veterinarian, considering factors like age, lifestyle, geographic location, and specific risks. Skipping or delaying these preventive measures puts at risk not only your dog's health, but also the community's public health. Myth 7. If the dog has beautiful coat, he is healthy. External appearance can be deceiving when it comes to canine health. A shiny and apparently healthy coat doesn't guarantee that everything is well internally, and many serious conditions can be developing without immediately affecting the coat. Kidney disease, for example, can progress silently for months before causing visible changes in the coat. Similarly, initial heart problems, developing diabetes, or even certain types of cancer can be present, while the dog still maintains a normal external appearance. Subtle nutritional deficiencies may not immediately manifest in the coat, but still be affecting important organic functions. A dog may have B-complex vitamin deficiency, or essential minerals that compromise immune or metabolic function, but still temporarily maintain an acceptable coat. Hormonal problems like hypothyroidism or Cushing's disease may be developing gradually. In the early phases, the coat may appear normal, but other body systems may already be affected. When coat changes finally appear, the disease has often already progressed significantly. Therefore, regular laboratory tests are essential. Blood tests can detect changes in liver enzymes, kidney function, hormonal levels, and other health markers long before problems manifest externally. Complete blood counts can identify anemia, infections, or other blood problems while the dog still appears perfectly healthy. Health assessment should always be based on a combination of physical examination, medical history, and appropriate diagnostic tests. Myth 8. Dogs understand punishments after misbehaving. This deeply rooted myth is based on an incorrect interpretation of canine behavior and can seriously damage the relationship between owner and dog. Animal behavior science clearly demonstrates that dogs do not connect delayed punishments with past actions. The canine brain works differently from the human brain when it comes to temporal associations. Dogs make associations in the moment. They cannot connect a scolding given hours later with something they did previously. When you come home and find the couch destroyed, reprimanding the dog at that moment makes him associate your arrival and your presence with something negative, not with the act of destroying the furniture. What owners interpret as guilty face are actually signs of stress and fear in response to the owner's altered tone of voice and threatening body language. The dog is reacting to your behavior in the present, not showing remorse for past actions. This misinterpretation leads to cycles of inadequate punishment that generate anxiety, fear, and can even worsen behavioral problems. Training methods based on delayed punishment can create anxious, fearful, and even aggressive dogs. Instead of solving behavioral problems, these techniques often make them worse, creating new problems like separation anxiety or fear of the owner. Positive training methods are much more effective and build a healthy relationship based on trust. Positive reinforcement, behavior redirection, environmental management, and consistent training produce lasting results without damaging the emotional bond. When behavioral problems occur, the solution is in identifying the root cause and working proactively and positively. Correct information saves lives. Each of these myths can have serious consequences for the health and well-being of our dogs. As responsible owners, our obligation is to seek knowledge based on scientific evidence and qualified professional guidance. Don't believe everything you hear or read on the internet. Always consult licensed veterinarians for guidance on health, nutrition, and behavior. Question information that seems too simple for complex problems. Invest in regular checkups, adequate vaccinations, preventive care, and continuous education about canine care. Remember, loving a dog is also caring for the truth about its health. Your best friend depends on you to make informed and responsible decisions that will protect their health, happiness, and longevity. Don't let dangerous myths compromise the well-being of the dog you love so much.